How do we find our place in the world? How do we find the place where our unique talents intersect with the needs of the world? And when we find that place, how do we best position ourselves for our highest contribution? A number of years ago, I fulfilled a dream, and in fulfilling this dream, my ideas on my true vocation, my place in the world, and on how I can, in a small way, contribute to the needs of the world, profoundly changed. This dream fulfilled? Well, it starts here. It was here where I fulfilled the dream of every North American amateur soccer player. To be walking along the beach in South America and to be invited to play soccer, this beautiful game, with the locals. I traveled to South America and found myself walking along this beach, and on this beach, there are concrete pitches, much like this one, designed for 4-on-4 soccer. And as I strolled past this particular pitch, 7 young men ran towards it for a match. And on seeing me, they motioned, well, more like enthusiastically beckoned, for me to join. And this was an unlikely invitation for the 40-something walking along the beach. You see, they needed a 4th to round out one of their teams, and I guess I looked as though I could do the job. Now, being conscious of the risk that I was taking in walking alone on this beach and not knowing the true intentions of these young men, I kept walking. But they were unrelenting, eventually kicking me the ball, which seemed to be a gesture of good faith. And so I promptly, and skillfully I might add, returned the ball, which demonstrated to them that I did possess some talent. Well, this only served to heighten the intensity of their invitation. And so I stopped. Now, in that moment, I had a choice. I could choose to accept the risk, step onto this pitch, and fulfill a dream, or simply keep walking. Well, you know how this story ends. I chose to accept the risk. And there in the heat of a South American midday sun, that was the moment when my view of the world began to change. Their English was about as good as my Spanish, and with a brief introduction to my teammates, the play began. But it wasn't really how I imagined it. It took me a little time to find my touch on the ball on a concrete surface. You see, I'd only ever played on grass or turf. And as I found myself settling into my position, I was surprised. No one passed me the ball. You see, there was a rule I continued to break in this game, in finding my space. And each time I broke the rule, the play would stop. One of my teammates would come over and do his very best to explain to me the rules of this pitch. I'd even scored a goal, only to have it called back because of a 3rd rule infraction. Now, it was clear that our team of 4 wasn't functioning at all. And the beautiful game's a passionate one, and so a friendly argument broke out. English and Spanish, much hand-waving, and for me, a realization that to this pitch, I'd brought my North American game, and they were playing a very South American game. Now, in order to understand this, you need to know that style of play is vastly different. South Americans traditionally play an open style of soccer, one that is creative, free-flowing, and uncertain. In comparison, the North American game, which for me was largely influenced by a Commonwealth style of training, is one of more rigidity, greater discipline, less freedom of expression. South Americans are renowned for their technical abilities. They are confident with a ball at their feet. They creatively explore a way to move the ball forward. Their play is instinctual and simply unfolds. And while my game just didn't match, you see, I'd been playing how and where I wanted to, not how and where my team needed me to be. And if I were going to make this work, I needed to embrace their creative style, to embrace the uncertainty of their play. And so I did my best. The play resumed, and I promptly slipped and fell on the dirty concrete surface. It was clear to them that I wasn't accustomed to this, the playing surface or the rules of their game. And to make this work, I was going to need to listen, observe, and learn from my team to find out where I fit. And in order to do this, I needed to be coachable. And that meant my team members leading me. And once this happened, well, it was kind of magical. Their game became our beautiful game. The play resumed. Our team was fluid. I even scored a goal. And this time it counted. And what was clear as the game went on was that they were going to determine when the play ended, not me. They would determine when this game would end. And at the end of a long afternoon of soccer, my teammates and I emerged victorious. We'd won the day. And we celebrated our victory together. And South Americans certainly know how to celebrate. So what was it that brought me to that beach? Well, it was another dream, and I think it's a dream that many of us have. A dream to help, to make a difference, to find a place where we can contribute. I'm a physiotherapist, and I work with children and youth who experience complex pain. And early in my training, I had decided that one day I would pursue global health work. It was this that brought me to South America, to find the place where my talent could intersect with a global health need. I'd come here to volunteer in a large hospital in a resource-scarce region. You see, there was a team here who also needed a fourth. And as I saw it, I just needed my head and my hands to do my work. Physiotherapists really, I think, are ideal global health volunteers. For most of the work that we do, we don't need sterile instrumentation or operating room theaters, just our head and our hands. So I felt optimally positioned to make a contribution here. I'd even partnered with a local physiotherapist who worked in the hospital that I'd be volunteering in, and through conversations, we decided what I thought were the needs of the clinical community there. And so to that end, I'd prepared a series of lectures on best evidence pain management. I was ready, but I was realistic, because the need that I was attempting to help with in a small way is unimaginably large. You see, pain's a big problem. The World Health Organization and the International Association for the Study of Pain have declared that access to pain management is a fundamental human right, yet 5 billion people lack sufficient access to treatment for moderate to severe pain. And we're pretty sure this problem is worse in resource-scarce regions, where there's a higher incidence of pain-related trauma from road and industrial accidents, and a higher prevalence of pain-related disease like cancer and HIV. And to further compound the problem, the amount of pain education available to healthcare providers is woefully inadequate, with 90% of healthcare professionals in resource-scarce countries lacking the training they need in pain assessment and treatment to do their jobs. So at the outset, what I was taking on, what I was trying to tackle here, seemed impossible. But I had been moved by the notion that I must do something always accomplishes more than something must be done. Now, global health work carries with it substantial risk, with illness and violence at the top of the list. The hospital that I was volunteering in was located in a neighborhood where 53% of residents had been the victim of violent crime. Travel to and from this hospital required a car with tinted windows so that I wouldn't be seen. My driver informed me that we wouldn't be stopping at stop signs to reduce the risk of robbery. And on arrival at the hospital, the compound really, I had to enter through a heavily guarded gate. Now, once inside, I met my physiotherapist colleague, and she led me through the compound to the rehabilitation department, where the patients had already begun to gather. And I was taken to the front of a small, warm, unventilated room, and the patients formed a line to receive treatment from me. Now, my clinical colleagues also entered the room, and some patients gathered for them, and this wasn't really how I thought the day was going to go. I'd hardly even met these people. But nonetheless, the day began, and patient after patient after patient presented to receive treatment from me, and it became very clear that I wasn't going to treat my way out of this, let alone get to the training that I had planned to provide. I'd failed to appreciate that something as simple as the sheer volume of patients who required care would make my game plan impossible to execute. You see, to that room, I'd brought my North American game. And it wasn't going to work. Now, in this dynamic, there was a divide, an us and them. I was working in the same room as my clinical colleagues, side by side, but definitely not together. And in this, there was no really easy way for us to connect on a deep, meaningful level, let alone exchange knowledge. And that extended to the patients. I could only really connect with them in a superficial way. And admittedly, there was a safety in this, a sterile quality, because sticking to my game on doing for instead of building with, well, that meant I really didn't have to connect or get too close to the real challenges that my clinical colleagues faced or the real challenges that our patients faced. But this wasn't why I'd come. And so I stopped. Now, in that moment, I had a choice. And many of you might think, well, choosing to accept the risk here was going to this dangerous region of this city. But no, choosing to accept the risk here would mean truly stepping onto this pitch, in this hospital, this rehab department, with these clinicians and these patients. Truly stepping onto this pitch would mean I would have to step onto a surface on which I was unaccustomed, into a game whose play would be uncertain, and into a game whose endpoint would be determined by my clinical colleagues and the patients, not me. Well, you know how this story ends. I chose to accept the risk. And really doing that is hard. Requires a vulnerability. And it was frightening to be exposed. Because really stepping onto that pitch meant that I had to face problems that occur solely as a consequence of geography. I met children who live and work on the streets, people who lived in their communities for generations, only now to be forced out because of progress. I saw treatable conditions that went untreated. And I saw the injustice in global health resource allocation. And I can't unsee those things. But it was only in embracing this uncertainty in a spirit of cultural humility that I was able to begin to understand where on this pitch I was needed. It was that vulnerability that gave way to opportunity and understanding, that understanding that allowed me to truly be coachable so that I could find out where in this beautiful game my team needed me to be. Resources in this hospital were scarce, and planning in the way I'd become accustomed was simply not possible. I needed to leverage the expertise of my colleagues. They, of course, were closest to the real problems and challenges they faced on a daily basis, and of course then they would have the best ideas for solutions. And so I positioned myself to be coached, to be led. And I worked with them side by side, and together we creatively looked for solutions for complex problems, and in that, connected in a very deep way, and exchanged knowledge in a meaningful way. And this extended to the patients, where we could connect also in a deep and meaningful way. And once this happened, well, it was kind of magical. Our game was a beautiful one. Equally skilled clinicians working side by side with different styles of play on the same pitch, creatively exploring a way to move the ball forward for our patients. And in this work, each of us leaving a bit of ourselves with the other, I left with them a little of my talent and they with me, a profound sense of just how to intersect that talent with the needs of the world. And when we saw them, we celebrated our victories. And South Americans certainly know how to celebrate. So what does this mean for us? Well, you know that it starts with a choice. If I'd kept walking that day on the beach, if I'd taken the safe alternative, I never would have fulfilled a dream. So choose to accept the risk. Step onto that pitch, wherever and whatever that pitch is for you. Embrace the certain uncertainty that will come with that. You will most likely fall, and you will most certainly need to get dirty. Listen and learn from your team and creatively explore a way to move the ball forward. To do this, you're going to need to be coachable. Go where your team needs you to go. And often you're going to find that where they need you is precisely where your comfort zone ends. And when you see them, celebrate your victories. Now, this initial journey to South America has led to many other amazing journeys around the world and the privilege of being a part of many other beautiful games. And on one such journey to another resource-scarce region, I met a woman, a local woman, who had literally no financial resources at her disposal, literally nothing. And she told me the story of her beautiful game, of how years earlier she had realized the need for a hospice for the care of dying children and their families in the community that she served. She told me of the risks that she chose and the pitch on which she chose to step, the impossibility of building something from nothing, the uncertainty in that, and of her vulnerability and of her faith in leading her through it. She spoke of the need to be coachable at every step in the process by the members of her community. Her only ask was that she be placed exactly where she was needed. And of course, she spoke of celebrating with her community their victory in eventually realizing their goal. And I'd like to leave you, as I was left after talking with her, after she told me the story of her beautiful game. When she finished telling me the story, she left me with a challenge, the same challenge I would like to leave with you. When she finished telling me her story, she looked me in the eyes and she said, "Well, that's how we do it. Now, what about you?" Thank you very much.